increased risk of cot death, and the children of smoking parents are 50% more likely to suffer from chest problems, asthma and ear infections. The scientists are urging the government to restrict smoking in thousands of public places.
This is the most definitive study into the effects of breathing other people's smoke, and it states categorically that passive smoking causes lung cancer and heart disease. Government scientists say although smokers have 15 times the risk of getting lung cancer as non-smokers, passive smoking also causes many deaths.
With respect to lung cancer, it would be a few hundred, and substantially more than that with respect to heart disease, but it's difficult to give precise estimates. There's some uncertainty. Among children, about 80 cot deaths are attributable to smoking in the home, thousands of cases of respiratory illness, and a large number of cases of asthma.
Terry Kavanagh has never smoked, but 9 years ago he had most of his left lung removed after developing cancer. He's convinced that years of working in a smoking environment led to his lung cancer, and he now organises charity walks and events to raise money for anti-smoking charities.
Well, I was really shocked when I was told that my illness was caused from someone else's cigarettes. I thought just by not smoking that was enough. Obviously it wasn't. I think the smoker must realise now, because of the evidence that's being put forward is overwhelming, that smoking does kill not only the smoker, but people who don't smoke.
Government advisers admit the public may be suffering from health scare fatigue, but say it's vital today's report hits home.
This is the big one. This is the one that really could change the health of the population of this country. There are 120,000 deaths a year related to cigarette smoking. Couple that with the implications of breathing other people's smoke, both for adults and children, then you have a huge problem, and we could do something about it.
Today's report was deliberately timed to coincide with National No Smoking Day. The tobacco industry is worried that its findings may encourage ministers to introduce draconian measures to stop smoking in public places.
At the end of the day, we don't believe that this warrants the type of noises the government have been making for public places, regulation, possibly even some form of legislation. People should be allowed to make up their own minds.
A government white paper this summer is unlikely to include legislation to outlaw smoking in public places, but a big increase in voluntary curbs by shops and places of entertainment will be encouraged. Fergus Walsh, BBC News.
And I'm joined now by Fiona Castle, the widow of the late performer Roy Castle. He died of lung cancer in 1994. Fiona Castle, you've, I believe, never been in any doubt that your husband died of passive smoking, effectively.
Well, we were told, Edward, that that was the reason why Roy got lung cancer, because he'd never smoked, and the particular kind of lung cancer he had apparently is only found in smokers.
Well, in the light of what the government scientists have found today, what do you think the government should do in terms of restricting smoking in public places?
I think they should ban it completely. It would be wonderful. But I understand that they have to do a slowly process. It can't all be done at once. But I think that they must be made more aware now of what they're doing, what the smokers are doing to other people, and especially, as we've heard, to babies, as it's contributing to cot deaths as well. I think it's a vitally important document that we've just heard about.
You'd accept that bans are unlikely, unrealistic?
I think maybe in the short term, but certainly not in the long term. I think as they say, that we've got to really review this and take it seriously and realise what it's doing to people's health. So hopefully in the long term it will become an outlawed substance.
Well, in a moment we're going to talk to Ian Burks, who represents Gallagher Limited, one of the biggest cigarette manufacturers. What would you say to him?
Well, it's very difficult to talk to tobacco companies, but I realise what they're doing, because if 200 people a day in this country are dying of a smoking-related disease, they've got to recruit more people to smoke to keep up the revenue.
Fiona Castle, thank you very much indeed, and we're joined now by Ian Burks from Gallagher, the largest cigarette manufacturer in Britain. Mr. Burks, care to respond to that?
Yes, I think the report covers two main areas. One is smokers and one is non-smokers.
Actually, one of you care to respond to what Fiona Castle has just said?
I think she's entitled to her view. Of course she is. We do not accept as Gallagher that tobacco smoke is a proven cause of disease in non-smokers. Far from it. It's interesting that only last week we had a major international study sponsored by the World Health Organization across 12 countries, 7 years, years, and it actually came out with findings that were not statistically significant.
Of course.
I'm not sure today's report adds much new to the debate. It's a repackaging of ideas and opinions. I'm not sure it really adds a lot that's new.
You of course, don't accept that smoking causes lung cancer, active smoking causes lung cancer, do you?
We accept that smoking is a risk factor. That's obvious.
It's just that if you don't
knows
accept that, one is entitled to be a bit sceptical about your views on passive smoking.
Sorry, please, we accept that smoking is a risk factor and that people can make their mind up about whether to smoke or not to smoke based on an enormous mountain of information that's been around for a great many years. It always seems to have been there, and I'm sure it always will be there. If people then make up their mind and want to be a smoker, well, that's fine. Let them smoke. Let them smoke my company's products. That's the business I'm in. But whatever your views about smoking, it doesn't necessarily follow that tobacco smoke is a proven cause of disease in non-smokers. Far from it.
What advice would you give to smoking parents?
I think there is a lot of information. People should take that on board and come to their own view. Of course, a parent, a mother, may not choose to smoke over her baby in a cot or whatever. That is common
particularly
sense.
when today's report suggests that there's a 50% increased risk of children suffering from serious breathing difficulties if their parents do smoke.
It's a very serious debate that needs to take place, sudden infant death syndrome or cot death. And there are a great many factors that are being considered and are probably still to be considered. I don't believe you can take the issue and lay the blame at the door of tobacco smoke. That is too simplistic and is probably very, very wrong.
Mr. Oakes, thanks very much indeed. Child Support Agency is under attack again. MPs claim it's inefficient.